Hello students, today I am going to teach you how to do peripheral joint mobilization for the glenohumeral joint. Okay. During the passive joint mobilization, you should have very sound knowledge about the joint structure, what are the articulating bones, what are the shapes of the articulating bones, and which bone you are supposed to mobilize. Okay, so you know that what is concave convex rule and how it implies in the movement of the joints. Okay, I assume that you are all very clear about all these concepts, so that I am directly going to the techniques. Okay, and you should have a sound knowledge about the treatment plane and then the resting position of each joint. Okay, and then you should know what are the physiological movements that are possible in that particular joint. Okay, so the physiological movements are otherwise known as osteokinematics. And arthrokinematics means the mobilization techniques what you are giving to the joint to enhance the particular physiologic movement. Okay, for example, inferior glide, superior glide, posterior glide, anterior glide and distraction, long axis traction, all those techniques. Okay, all these techniques are called as orthokinematics. They are the movements that is happening inside the joints. Okay, and they are given as passive mobilization techniques to enhance the physiologic movements. Okay, so you should know which joint surface you are moving, whether the bone you are moving is a convex one or a concave one. Okay, so according to that you are supposed to know the glide, which glide enhances the particular physiologic movement. Okay, so in the exam they might ask you directly to give a particular joint mobilization technique to a joint, or they might say you have to mobilize this joint to enhance this particular movement. Okay, so you are supposed to know which glide is supposed to be given to the for the enhancement of the particular movement. Okay, so I assume that you all are very clear about all these concepts, so that I am directly going to the practical demonstration. Okay, so first today I am going to teach you the passive joint mobilization to the glenohumeral joint, that is the shoulder joint. Okay, shoulder joint is having two bones, that is and the scapula. Okay, so here humerus is having the convex head and we are mobilizing the convex humerus. Okay, so have that in the mind. And the resting position for the glenohumeral joint is 55 degrees abduction and 30 degrees horizontal adduction. Okay, and in neutral rotation. Okay, so this is the resting position. So they might ask in the exam to use the resting position to give a particular mobilization technique, or they might give you a particular range of motion. So in this range of motion you have to enhance the movement. Okay, so you have to position the patient's body part according to the question. Okay. So first you will start giving the distraction. Okay, distraction is a given to enhance the general mobility of a joint. Okay, it is not given to enhance a particular movement. Okay, so I am supporting and the patient is in the supine lying position and I am having a belt stabilization for his chest. Okay, so it's running like this. Okay, so this is a belt used for stabilization during mobilization. Okay, and I am holding his distal humerus with my left hand and I am cradling his forearm with my forearm. Okay, and see, this is my right hand grasp. Like this I am grasping. Okay, grasping under his axilla and then distracting it outwards. Okay, perpendicularly outwards. That is the distraction or a lateral glide. Some literature they mention as lateral glide. Okay, okay, so this is how you give distraction to the glenohumeral joint. Okay, this you can give in 90 degrees abduction also. Okay, the same hand placement. Okay. And then the next position is, once the range is the general range of motion is improving in the joint, you can use the 90 degrees flexed position. So shoulder and elbow are in a 90 degrees flexed position. Okay. And then grasp his proximal humerus, okay, with both your hands, okay, hold it tightly and then apply a distraction. Okay, I'll show you again. See, so this is how you apply distraction in the 90 degrees flexion of shoulder. Okay.